Have you been feeling sad for most of the day for the past few weeks? Are you finding it difficult to enjoy activities in which you previously found pleasure? If so, you may be suffering from a very common and frequently undiagnosed medical illness. Depression is not simply the blues or being down in the dumps. Rather, it is a serious, persistent illness with significant consequences. The good news is that once diagnosed, the condition is treatable and a return to your old self can be expected. For many years, depression was viewed as an emotional condition. We now know that although emotional symptoms are prominent, the illness is clearly biologic in nature. Depression results from an imbalance in the normal chemicals involved in the transmission of brain cell signals, including norepinephrine, serotonin, and dopamine. The biologic basis of depression is also supported by studies of genetic transmission and brain metabolism. Any person of any age can develop depression, but women and older patients are at a higher risk. A family or personal history of depression also increases the likelihood of an episode. Other risks include lack of social supports, significant life stress, and alcohol or substance abuse. Depression can worsen underlying medical conditions such as diabetes and heart disease, so untreated illness is associated with an increased likelihood of debility and death. There is no single symptom and no blood or radiologic test which allows depression to be diagnosed. Physicians will assess the existence of a number of symptoms: sadness, loss of pleasure, weight and appetite changes, increased or decreased sleep, agitation, fatigue, guilty feelings, indecisiveness, and thoughts of suicide. These symptoms must be present every day for a period of at least 2 weeks to allow a diagnosis to be made. If depression is diagnosed, it is important to evaluate the potential that other illnesses or medications may be a contributing etiology. Thyroid dysfunction is a common cause, as are a whole variety of prescription medications which have depression as a side effect. There are a number of treatment options. Talk therapy, not necessarily psychotherapy, but rather supportive counseling and listening, may be effective in and of itself. There are multiple medication options which work on the biochemistry of depression by affecting brain levels of norepinephrine, serotonin, and dopamine. Patience is required, as it may take 6 weeks for medication to reach their full effect. In severe or resistant cases, electroconvulsive or ECT therapy may be very effective. It is estimated that as many as 20% of us will suffer from a major depression once in our lifetime, so illness is common and all around us. If you think you or one of your family members may be one of those patients, make an appointment to meet with your primary care physician as soon as possible.